Hello, my name is Eugene Milne. I'm Director of Public Health for Newcastle. I'd like to talk to you briefly about the vaccine programme that's now rolling out across the country and is rolling out with considerable success across the North East. This is the biggest vaccine programme that's ever been conducted in this country and is enormously important in getting us out of the pandemic and back towards normal life. It is the light at the end of the tunnel. The vaccines that we have available now are more effective than I think we could possibly have hoped for in the early stages of the pandemic. We know that 2 doses gives better protection than 1, but we also know that the first dose of the vaccine gives a very large amount of protection. And we need to get the first dose to as many people as possible, as quickly as possible, which is why we spaced out the 2 doses in the regime to 12 weeks rather than 3 weeks as was originally planned. But you shouldn't worry about that. Getting the vaccine will still give a very high degree of protection, but it's also important to get the second dose when you're called for it. Indeed, for one of the vaccines, the protection seems to be better if the dose interval is a bit longer. Now, it's also important to know that as the vaccine is rolled out, we need to keep in place the protective measures that we've used throughout the pandemic. This is because although the vaccine will give you a lot of protection when you've had it, it may not prevent you from carrying the virus or having an asymptomatic infection that might spread to somebody else. So the rules about hands, face and space need to stay in place for the foreseeable future. We hope that we'll be able to lift those at some point as we get nearer to the whole population being covered. But for now, in order to protect others, it's going to be necessary to carry on with those rules. We will be able to return to normal at some point. While we're doing that, you should still obey the rules of the test and trace system as well. So if you're called by test and trace, even if you've had a vaccine, please self-isolate and follow those rules until the time when we can lift them. If you've had COVID in the past and you called for a vaccine, don't worry about that. Think of it a little bit like having more than one booster of the vaccine itself. If you've developed antibodies to COVID, then the vaccine will boost those as well and may increase your level of protection. We don't know how long the level of protection will last for the vaccine, but it certainly lasts for a good number of months and seems to give great protection not only against the risk of death, but also against the risk of severe disease. This is going to be enormously important. We know that new variants that are prevalent in this country now are also sensitive to the vaccine. And scientists nationally are keeping a very close eye on variants as they arise in case any of that changes. In the meantime, if you have the opportunity to get the vaccine because you're in one of the risk groups, I very, very much encourage you to do that. These are safe vaccines and these can deliver great protection, and they are the way out of the problems we've had in the last year. Thank you.